As the number of confirmed COVID-19 active cases continue to increase, the Mandela Bay Municipality has intensified inspections at old age homes, frail care facilities and retirement villages, as the elderly are the most vulnerable. Various environmental health practitioners have been visiting these facilities to inspect and investigate if the COVID-19 regulations are being adhered to and what measures are in place to contain the spread of the virus.
The Environmental Health Services Department at the Nelson Mandela Bay Municipality is currently conducting evaluations of all facilities that accommodate older people, whether it be an old age home, a frail care unit or a retirement village like we have here today, just to establish whether they do have all their protocols as far as COVID-19 in place. We do find sometimes that there are facilities who are not fully aware or do not have a comprehensive COVID plan in place, and we have people visiting some of these premises and in that way spreading the virus to some of the residents inside the facilities for the older people. Some of the people that we found, when we interviewed them, they admitted to us that they knowingly well knew that they were positive while visiting their parents or their grandparents in these facilities, and in such a way actually came into contact with them and gave them the coronavirus. We've had some fatalities because of that. Hence we are now for the past 2 or 3 weeks busy with conducting all these evaluations at old age facilities to determine whether they did have or do have positive cases and how they obviously manage those cases to try and prevent the spread of the virus to the other residents in these facilities.
Resident Services Manager from Eco Foundation detailed how they contain the spread of the virus in their facilities.
So every morning our village supervisor phones on an internal phone each one of the residents and they talk to them. So if that person coughs or they're short of breath or anything, she actually leaves her office, she goes masked to see that person. If there's any cause for concern, so they have a symptom, then we call either our village nurse in or she will send them straight to the doctor. And so we immediately, is it something to worry about? And our nurses also can do they will come to the house and do their test, the nasal swab. So that's how we contain it. But definitely where we're seeing the increase is on contacts from outside.
Environmental health practitioners will visit these elderly facilities across the city to enforce adherence of COVID-19 regulations.